Hi, my name is Lauren and this is Rain. Today we will be talking about wound care and bandaging. Alright, say you walk into your horse's stall and you see that he has a cut on his leg, like this one here. If this cut does not have much blood coming from it, and if it's just a skin scrape, we can follow these few steps to clean the wound and aid it with its healing. So first, we will be using clean water to rid the area of any dust or bacteria. So you can do this with clean water from a hose, and we will be using it from a bottle today. So we just wash the area. You want to wash it thoroughly to get off any dust or dirt that may be surrounding the wound and the area. Now that we've done that, we can use a solution of water and betadine, which is a surgical scrub to help clean the wound from microbes. We have our solution here with the betadine and the clean water. We can use some sterile gauze pads to clean the area. We'll dip it in the betadine solution. We'll move back over to his leg with the wound. Hi, handsome. And we'll gently scrub at the wound. Now that the area in the leg has some betadine on it with iodine, we want to re-wash the area with that clean water. Again, you can use a hose, but a bottle is fine too. And you want to make sure that you clean the base of the leg as well, that now has the iodine on it. Now that the area is free from the iodine and any dirt or bacteria, we can dry off the area just using a clean towel. Now, to aid in its healing, we want to use some triple antibiotic ointment. Now, since this ointment is on the sticky side, we want to protect it from attracting any dirt or dust or shavings or hay. So we can use the same sterile gauze pads over the top of the wound. We can fold it to make it a little bit smaller to fit the area. We're going to place that right on top of the wound and use our rolled gauze to roll around his leg and over top of the gauze pad. This can also be done using vet wrap. If you see a wound on a horse's joint, like a knee, you want to call the vet to avoid any infections that he may get in the joint. Now, if you see a horse that is profusely bleeding, you want to apply pressure and immediately call the vet to avoid any blood loss. If you see a horse with a puncture wound with an item sticking out of it, you want to keep the item in, you do not want to remove the item, and you want to call the vet immediately. If you're inexperienced with any of these wounds or treatments, ask your barn manager, trainer, or someone more knowledgeable to help guide you through these steps. Say you're treating a wound similar to the one that we just treated in the previous video, or your horse has an internal injury, you can use standing wraps to help protect the area and protect the leg. So the first thing you want to do is make sure that they're the right size. They should span the width of the cannon bone, just below the knee to just below the fetlock. The same can be applied to the hind limb, where it spans the area from just below the hock to just below the fetlock. So we want to start on either side of the cannon bone. You can either start on the inside or the outside. I like to start on the outside. So when we wrap around the leg, you want to make sure that on the outside of the leg is facing towards the back of the horse, like so. You're going to wrap around the horse's leg. You want to try to keep it fairly tight. And when we reach the end should also be on either side of the cannon. Here it ends on the outside. Now we can take our bandage wrap and insert that within the wrap here. And we can wrap it around the bandage like so. And at this point we want to be careful of our tension. So when we pull too hard, it can make it too tight and cause some more injury. So we can start wrapping down. And again, be careful not to make it too tight or too loose. Too loose could cause it to slip down. And now that we reach the bottom, we could leave a little bit of the standing wrap. At the edge here, you see some white. And now we'll go back up to the top of the wrap. And your horse may move around, and that's okay, as long as you keep a hold of the wrap. And now we're approaching the top of the wrap. We can keep a little bit at the top as well. And now that we've reached the top, you can start working your way back down. And we've reached the Velcro. Now, ideally, you want the Velcro to be on the outside of the horse's leg. In this situation, you would want to rewrap so that the Velcro would be on the outside to prevent his other legs from rubbing up against the Velcro and potentially undoing it.
Hi everyone, we're back. We're going to go over some temperature, pulse, and respiration basics, also known as TPR. We're back with my horse Bianca here. The first part of TPR is, of course, temperature. So there's two ways to take the temperature. You can use a mercury thermometer or a digital thermometer. Mercury thermometers are known to be more exact because they can go farther up into the horse. Digital thermometers are usually safer and faster because they don't need the time for the mercury to rise. I prefer to use mercury. The only problem is you have to practice before you really use it because there's a very fine silver line in here that's the mercury. You really have to practice and be able to you can see it before you put it in the horse. The other important part is that because these are glass thermometers, they do break, so you have to be more careful. We usually have some kind of rope and then a clip so you can clip it into your horse's tail. That way if it falls out or gets sucked in, it's not going anywhere and it's not going to be in a dangerous place. So to take your temperature, you're going to come around to the back of the horse. You're going to make sure that she knows that you're here. I usually rub my hand along her butt, and I'll usually play with her tail a little bit so she's more comfortable with it. You'll use some kind of lubricant on your thermometer. I tend to use spit because it's convenient. You would just spit on the thermometer, lift her tail up really nicely, and then just stick it in her butt. Then you would go with your clip and clip it onto the some portion of her tail so that it won't fall out if she were to poop. Then after 2 to 3 minutes, you're going to pull your mercury thermometer out and look at it to see what the temperature is. With the digital thermometers, they're pretty easy. You just turn them on, stick them in, wait for them to beep, and then you're done. So that's why many vets prefer digital thermometers, because they are safer and faster. They're also better for people who have less horse experience, because you don't have to stand behind the horse as long. So the next portion of TPR is pulse. So there's 3 ways to take the heartbeat. There's a vein underneath her cheek. It's called the jugular vein. It's really hard to show, but it feels like a pencil. You can kind of roll it back and forth. You can use 2 to 3 fingers and tell the pulse that way. Don't use your thumb. Your thumb has a pulse and it'll give you the wrong number. The second way to take your pulse is on her leg. So down here, yes, thank you. On her muddy feet, right in between her legs, there's another vein here that you can feel. Again, don't use your thumb. Count 15 or 30 seconds. Depends. Make sure you have a watch, and that'll give you a pulse as well. The best place to do it, though, is to use a stethoscope. My stethoscope has 2 sides, so make sure you're on the drum side and not the bell side. You're just going to put your stethoscope in. It's right behind her shoulder here. Snug it up tight, and then just wait. She has a pretty strong heartbeat, so it's really easy to hear. If you can't hear a heartbeat right off, I would try going higher, lower, or farther into your armpit, because the horse's heart is always on the left side of their body. So it's there, it might just be quiet, or you might be in the wrong spot. The last and final part of TPR is respirations. These ones can be tricky. because horses like to sniff things and move their head around. And the best way to take respiration is you just stand quietly and have them stand quietly, although she's being a little fussy right now. And you just look at the rib cage and you count their breaths. It's the easiest way to do it. It can be hard, especially if your horse is sniffing or in cross ties. There's other ways to do it that vets will use. They'll put plastic bags over their nostrils to count their intake and outtake. You can just hold your hands over their nostrils, but horses will tend to sniff you that way too. That's it for TPR basics. We'll see you in the next video.
Hi everyone, we're back. Now that we've learned how to take our horse's TPR, we are going to learn some red alerts about TPR, but first we need to know what a normal range is for the horse before we get into red alerts. So a normal temperature for the horse is between 99 to 101 degrees Fahrenheit. A normal pulse for a horse, or heartbeat, is 28 to 44 beats per minute, and a normal respiration rate for a horse is 10 to 24 breaths per minute. Now the red alerts for these are when the temperature gets above 101 degrees Fahrenheit. For a pulse, if that pulse is high while that horse is resting, not a good sign. And then for respiration, if that horse is standing still and breathing really hard, that's another issue. So a high pulse and a high respiration mean that horse has pain somewhere in their body. It can be related to colic, it can be related to an injury you do not see, but it is an issue. Temperature above 101, your horse is going to start to overheat. You'll probably see some sweating. They might have their tail lifted, try and cool them down a little bit. Make sure this horse has water. In all three of these situations, you're going to want to call the vet. It's very important that you monitor these. So if you notice that your horse has a high temp or pulse, you would write that temperature or pulse down. Keep an eye on the horse. Check it every 10 to 20 minutes to make sure if it's not going up or if it's going down, see what's changing. Just keep an eye on the horse, monitor it. Then when the vet gets there, you'll be able to tell them what's changed since you've called them, or update them if the situation's gotten worse. One thing we did not mention when doing TPR is capillary refill. Now, capillary refill is a great indicator to see if your horse is hydrated or not. So what you're going to do is you're just going to lift the horse's lip really gently, take your finger and push it against their gum. Now their gum in color is usually like red to light pink. You push your finger on it really hard, lift your finger away, you'll see yellow, and then it should fill back in with the blood in the capillary faster than 2 seconds. If it takes longer than 2 seconds to refill, or their gum line is really yellow or over red, like super bright red, something's happening in that horse's body. The blood's not circulating as well. They might have issues with oxygenation in their cells. So what you're going to want to do is call your vet, monitor your horse. If it just doesn't fill as quickly, make sure that horse's water accessible. If it's discolored, definitely call the vet. That means that blood's either going somewhere else in your horse's body, or something is happening in your horse's intestines that you want to get checked out immediately. That's all I have for red alerts right now. But as always, when you see something wrong with your horse, call the vet immediately if you do not know how to handle it yourself. Even if the vet doesn't need to come out and they can talk you through it over the phone, it's always better to check with your vet than try and fix things alone.
Alright guys, we're back with my horse Bianca here. You can see we've moved onto her leg. We're going to go over the basics of a polo wrap. Now, a polo wrap is a stretchy wrap that you can use to protect the horse's legs during exercise. So you can have it protects the back of the tendons, and it also protects the inside of the legs from hitting each other. It's not the same as a brushing boot because it does provide a little bit more friction, and they can sometimes be a little bit bulky. So we're going to show you how to put a polo wrap on to begin with. So the first thing you're going to do is make sure you're not in front of their leg and you're not kneeling or sitting on the ground for safety. So if she were to move, I could get up and get out of the way really fast. You're going to start the end of the polo wrap usually between the bone and the tendon. You can start on the inside or the outside depending on the wrap. I know this wrap will end on the outside, so I'm going to start on the inside. You're going to wrap around. You're going to pull on the bone, push the tendon. I usually will start in the middle of the leg, work up, and then work down. Try and make these wraps as even as possible. Prevents wrinkling in the horse's legs, and it can prevent bowing a tendon on accident. Gonna wrap it nice and tight. Not too tight that you think you're gonna cut off circulation, but tight enough that the wrap stays on securely. You can see that these polo wraps end in a Velcro. Always want to make sure that your Velcro ends on the outside. This one ended a little bit on the inside, that's alright. You can just shift it or start it on the other side of the leg so that it ends properly. Now you can see that my edges are pretty smooth going down, and that it's about a finger's tightness in there. Nice and smooth, there's no wrinkling, and you'll notice that I went down and cupped the bottom of her fetlock here. So with doing that, it provides a little bit of extra support for the back of her leg and her tendons. You can polo wrap without cupping, which I'll show you on this next leg here. We'll cut that from you. Alright, so on her next leg here, we're going to go ahead and do a polo wrap without cupping. So again, I'm going to start on the outside, just because that's how I like to do it. Start up top, get a nice groove going. I usually will go up one, work down, down. See, I don't go as far down to cup the full fetlock this time. I'm going to work back up before I get all the way to the bottom. This kind of polo wrap is totally fine. Anybody can do it. It can be used on horses even if you are unsure of what you're doing. You don't always have to have the cup. I know that I prefer the cup because it looks prettier and it creates a nice little V in the front of their leg that looks very professional. I also think I like the extra support of having those tendons and ligaments cupped there. So again, just a standard polo wrap just on the leg. Doesn't go down over the joint, doesn't cup anything, but still functions similar to this first one that I did.